I want to thank y'all for coming and joining us and being part of this press conference today. We're at a point in time in America's history and the state history where we have to talk about things that just a few years ago, none of us would ever have considered that we had to debate these things. We have been on a slippery slope in the United States for decades now. And incrementally, the federal government has taken more control of more and more parts of our lives, more and more parts of our children's lives, and given us direction and told us what we needed to do. And we've kind of sat back and we've said, you know, that's not a big deal. I can live with that. And the next infringement comes along a few years later and we say, well, that's not really a big deal. We can live with that. And then about 2 years ago, when the federal elections were going on, health care was a centerpiece for now President Obama. And I don't think people really realized what he was talking about when he talked about health care reform. We all realize that health care cost is an issue. Health care quality in the United States is not an issue. All of us can agree that we need to do something about making sure that health care is affordable. Insurance rates have gone up over the last number of years. It becomes more and more difficult for families to provide insurance for their children. And the little secret is, a lot of that's caused by the government itself. And Washington has made us get into the situation where health care costs have gone up. And how do they decide to fix it? By taking over 1/6 of the U.S. economy. By telling Alabamians that you will take part in a federal health care system. Who would have thought that the founding fathers could have envisioned a United States government that would not only control and run and partially own banks, but they would also own automotive businesses. And then they follow it with health care, which gets us to where we are today. Americans of all walks of life are trying to decide, what are we going to do? People sit at home around the kitchen table with their friends, relatives, and they ask themselves, who can do something? Who can try to stop the onslaught of the federal government into our private lives? That's absolutely right. The people will. And I believe the people will in the fall, and the people will here in Alabama in the state legislature today. Attorney generals across this nation have filed suit to fight against federalized, socialized health care. Alabama's Attorney General is doing his part. He's taking part in that role, in that fight. And the second arm, or the second prong of that attack, is in the state legislatures across the country. The states are the hope for the republic. Forty now, I didn't say 4, I said 40 state legislatures across this country are considering legislation, much like what we're considering today, that will simply say that you cannot be forced into any health care plan. Senate Bill 233, if you want to go on the state website and look at it, I've passed out some copies to the press. Hopefully they've read it. It's basically a 1 to 1.5 page bill that says that you can't be forced into that system. Your doctor can't be forced into that system. You cannot be forced to pay fines or penalties if you don't agree to be forced into that system. And it protects the personal freedoms not only of you, but of your doctor to have that patient-doctor relationship with you. That's all we're talking about doing. And you would think, by the reaction of the leadership of the state Senate and the state House, that this was some unbelievable power grab by the states. It is amazing to me that they will stand with President Obama and Nancy Pelosi and the out-of-control U.S. Congress and block your right to vote on whether or not your relationship between you and your doctor is protected. That just amazes me. Now, for those of you who have watched what is going on in Montgomery this year, and it doesn't matter to me which side of these issues you're on, but they don't believe this is important. But if you've read the news over the last few days, what they're upset about is that the debate about health care might block their effort to get bingo. Now, you may be here and you may be for bingo, but when we're talking about personal freedoms and liberty and your rights, I believe that comes a lot further down the road of being where people want us to be than bingo does. Now, I want to give some credit today. We have a Senate Bill 233 that I sponsored. A number of members of the Senate caucus are here with us. Republicans from the Senate and the House are here to support this legislation. But I want you to know, they've had 3 bills in the House all session. A couple of them were pre-filed, and they've not been able to even get those out of committee. 3 of those sponsors are here. I think 3 of them are here today. Blaine Gallagher is one. Dr. Robert Bentley has a very similar bill. Representative Matt Gibson has a similar bill. And the funny story is Representative Blaine Gallagher had his bill on committee, on the committee agenda. We thought we would debate that today, and at the last minute, they pulled it off. The leadership in the House didn't have the common decency to put that on the calendar and leave it there because they knew you were coming down and they didn't want the pressure. Well, I hope that you will go into the House of Representatives today and you will go in the state Senate today and you'll put pressure on your elected representatives to do something that matters when it comes to liberty and freedom.